Hi, my name is Osher,
My name is Zhengyang.
My name is Yao.
and this is our presentation of our analysis of heart failure data.
About our data is gathered through the Kaggle website, which is called the Heart Failure Prediction. Here is the link that you can find our data. Here is our data. On the first row is our variables. The anemia is a disease where number of red blood cells is low, which leads to less oxygen flow. The creatinine phosphokinase is an enzyme that regulates muscle function. Ejection fraction is the percentage of blood leaving the heart at each contraction. Serum creatinine is the level of the serum creatinine in the blood. Serum sodium is the level of serum sodium in the blood. Time is how long the patient was observed before they die, which is measured in days. What we want? Why we want to study this case? Because the CVD is one of the most important factors of death of every year. So we want to find the relationship between all these variables. What are we trying to study first? We want to study variables like age, amount of platelets level in blood, level of serum creatinine in blood, whether the patient has diabetes or not, can impact the percentage of blood leaving the heart at each contraction. So our response variable will be ejection fraction, and the predictors will be the rest of variables, except the death event. Why we not include death event? Because death event bring us many troubles as we run R. And also the death event is a categorical variable, so that we do not include them. What are we going to do? We try to build the best predictive model to predict the amount of blood leaving by interaction, log, and run backward-forward model. Here is our result. This is a tense model that we ran from the original main model. But you can also see that the R square is still too low, so that we change our mind.
So after generating several models, we were still unable to produce a satisfactory R-squared value. So we were brainstorming why this was the case, and our first thought was perhaps there's missing values in the data set. So after analyzing this, we found that we had 100% observed values. So we decided that we should rework our hypothesis and instead use the death event variable as the response variable in our regression model. Given that death event is a binary variable, 0 or 1, 1 being death and zero being survival, we found we must use logistic regression in order to generate the model. So here is our model generated through the step function in order to generate the model with the lowest AIC that loses the least information. And so the most significant variables of the data set in order to predict the probability of death event was age, ejection fraction, serum creatinine, serum sodium, and time. Just a brief analysis of the model through logistic regression. For example, if age increases by 1, the probability of death in a patient would increase by about 4%. And at the bottom is the McFadden value. This is essentially a pseudo R-squared value. Given that logistic regression is different than linear regression, R-squared is not exactly applicable. The McFadden value is essentially very similar to the R-squared value, and describes how well the model fits compared to the null value. So judging by all this, it seems like a fairly good model. But if we look closer, the time variable has a very low p-value and seems to be highly correlated with the death event variable. So we want to do some further digging on this. So when we sort the data by time, we find that the shortest time values, the first 30 rows of the data set, for example, are almost always corresponding to death versus the 30 longest time values corresponding to survival each time. And we came to the conclusion that the time variable is directly correlated with the death variable, and this violates the assumption of no or little multicollinearity, because as time increases, death, the probability of death then decreases. So our next step was logically to remove time from our model, and this was the result using the step function again. We have more variables that were not present in the last model that seem to make sense, such as anemia and high blood pressure. The AIC increased, so more information is lost using this model. The McFadden value decreased, so it's not as good of a fit compared to the null model. It's starting to make more sense given the variables that are present in the model. However, the p-values are not significant enough to make solid conclusions, so we're still not satisfied with this model.
All right, so for our next move, as we mentioned before, when using death as a response, with variable time presenting will be a problem since it is not independent to the death. When it is not present for the time variable, we have variable that is not very useful for our model, and those we then decide to generate a new model using time as our response variable to see how the variables of the data set impact the time variable. In other words, which variables decrease time cause someone to die sooner. So after using the step function, the model consists of all significant variables which were intuitively influential on the time variable. So here's what we did. We are not using the logistic regression anymore since time is not a categorical variable like death. We are running a normal regression using time as a response variable, and death will not be a part of the predictor variable. Backward selection will again be used in this case, and our results will be on the following page. So before we actually show the results, we have to make sure all the assumptions fitted. So for our plot, as we can see, there isn't a specific trend like curve or something shown. All the dots are equally distributed among the two sides of the plot. Also, the variables are independent because death is not part of our predictor. So it basically fits all four assumptions. And those we have here allowed to move into the next step to the actual regression. So here comes our model that we will be using. As we can see in the model, with high blood pressure, when it is true, the time before the patient die will decrease by basically average of 28 days. And similarly to the anemia, when it is also present for the patients, then the time for the patient to die will decrease basically by average of 17 days. So about our finding, after we use the step function, the model consists of all significant variables which were intuitively influential on the time variable. And at the same time, the R-square value of this model was lower than the model that we used before, which I mean by death as the response variable. However, all the predictor variables were significant, which does tell us something useful about our data.
Now that we have our final model, we can continue to discuss the applications of our findings. So our findings can be used by medical professionals in a variety of ways. For example, it can help identify the patients that need more immediate attention. For example, they can use the measurements of the several variables contained in our data set, such as anemia, high blood pressure, age, and other significant variables, in order to estimate the time value. And of course, the shorter time values that are estimated would represent the patients that need more immediate attention, and those who need more immediate attention will be given that, and then it hopes to increase their survival. Next, it can also help identify the factors that are most important in managing in order to maximize the chance of survival within patients. So for example, anemia and high blood pressure, address those, manage those as needed in order to maximize the chance of survival. And lastly, one of the biggest issues regarding cardiovascular disease and death as a result of cardiovascular disease is not detecting it soon enough, and in turn not managing it soon enough. This our model, it can help estimate, again, the time value and detect the patients that may die sooner of cardiovascular disease, and in turn give them more immediate attention, help detect the disease sooner, and help manage the disease earlier, in hopes to maximize the number of survivals of cardiovascular disease.
And just to recap on what we did, so basically we start with using injection fraction as our response variable. We tried many models, and there's just no good fitting models at the end. As a result, we use deciment as our response variable. In this case, the logistic regression will be implemented due to the fact that deciment is a categorical variable. Time is not independent, and the model is not making too much intuitive sense. That's a problem with this model. So at last, we decided to use time as the response variable. The R-squared value of this model was lower, but all of the predictor variables were significant, which does tell us something useful about our data. And underneath is our final model. And thank you for your patience. If you have any questions, please let us know.